Hi, it's Dr. Betty Robin with the Dentistry Rising podcast. I'm an attorney, a dentist, and a practice cell broker. This podcast is my brainchild to help inspire, motivate, and educate dentists to create the practices and lives they want. I've personally owned 3 practices and worked with thousands of dentists in my capacity as their broker or attorney. I want to put my expertise to work for you and help you find the success you want. After all, you're my peeps. Let's get going. Stop. Do you really want to buy that practice? Let's talk about practices you probably want to avoid buying, especially if you're a first-time buyer or a little unsure about what you're doing. There are definitely practices that are good risks and practices that are bad risks. Today we're talking about the bad risk practices. I've talked about what I call these red flag practices before, but I've slightly changed and expanded my list. So let's get going. Here's my top 10 list. Number 1, a small practice. You can define small for yourself given what you want, but for me, small is a practice collecting less than about $300,000 a year. And I'd even really say about $400,000 a year. I mean, a practice collecting $300,000 is only going to net you about $60,000 a year after you pay practice loan debt as well as other expenses. Most of you are definitely going to have to continue your associate job if you buy a practice like that. Why do I think you should avoid small practices? Aren't they potentially diamonds in the rough? I just don't think so. A practice that's making no money takes you a huge amount of time and effort to turn the corner to reasonable profitability. If the seller couldn't do it, don't have such a big ego that you think you can do it. Doing some marketing isn't going to help. It'll take a whole lot more effort than that. Unfortunately, there are quite a few of these small practices on the practice cell market, but I advise leaving them as someone else's mistake and move on. Number 2, a practice that is less than 10 years old. I'm always suspect of a doctor selling a practice that's relatively new and he or she's only in their 40s. Yes, I know there are exceptions. People with horrible illnesses or people that had horrible accidents. People with nasty divorces moving across the country to escape. But if something like that actually did happen, make sure to include it in the contract as a fact that the seller is telling you. In general, doctors don't sell practices that are doing well. Why then are they selling? It is almost always the lease. People sell practices with leases that are way too high, leases that can't be renewed, or practices that have too much space overall. You just don't want to take on someone else's lease problems. I recently had a buyer come to me for legal advice about buying a beautiful practice in a gorgeous office building. The problem was the practice was making no money. I mean, really, no money. In fact, the seller had already taken off, believing the broker who said it would be a quick sale. On the surface, it was beautiful, a beautiful and expensive build-out, and still some equipment left in the space. But the lease was $15,000 a month for 8.5 more years. That is someone else's $1.5 million mistake. And you don't want it to be yours. Use your common sense. Number 3, a practice where the seller is not retiring. A practice where the seller is not retiring almost always has lease problems, as we just discussed, or is only one of the several practices the seller owns. Sellers make up all kinds of excuses about why they are selling. Again, use your common sense and cover yourself well in the contract. Or better yet, just avoid that practice. Number 4, a practice with more than about 10% of its revenue from Denti-Cal. Denti-Cal revenue can be uncertain and unstable. Some dentists really do know how to very profitably run Denti-Cal practices, but most of us don't. You can get in Denti-Cal problems pretty easily and end up on special claims review, on prior authorization, or with an audit, especially if you're new to the game. If that happens, almost all your revenue basically evaporates overnight. A bigger problem can be that the seller had Denti-Cal problems, and the office gets almost all of its revenues from Denti-Cal, and the seller knows the gavel is about to go down. If you see a Denti-Cal practice that seems to be an incredible bargain, beware. It is almost certainly a practice about to lose all or almost all of its Denti-Cal revenue. But you tell me, I'd be a new provider. All that's not going to apply. You might want to check with your attorney, but Denti-Cal is location keyed as well as provider and number keyed. I'm just saying, be careful. Number 5, a practice with primarily new staff members. The first question is, where'd they all go? I'd worry about new staff members, particularly if the seller has other offices. The good ones will probably move to one of those other offices. But sometimes unethical sellers give their best employees to their friends in town, and hopefully not with a patient list. And sometimes employees just take off when an office is selling. That doesn't happen too often, but if it does, you can generally replace people without too much of a hiccup, in which case you should probably enlist the seller's help and require they stay for a longer transition. Number 6, a practice where the practice broker insists you use a particular attorney or a particular consultant or accountant to evaluate the practice. I mean, this is supposed to be impartial, isn't it? Here, I just walk away if you can't use who you want and look at what you want. This doesn't mean to take weeks or months to do due diligence. That can definitely irritate all of us brokers. Number 7, a practice in which more than 10% of the patient base lives more than 5 miles from the practice. This can happen if the seller lives in another community or is part of a religious or other group that draws patients in. Patients would be very unlikely to continue with you if they are bonded to the seller in some specific way, unless you are part of that group, in which it may be a great sale. Number 8, a practice that has been on the market for an extended period of time. Most practices are seen by email or text by literally thousands of dentists looking for practices in the first couple weeks after they were listed. If everyone is passing it by, just ask yourself why. And you might want to walk away. Number 9, a practice in which the selling doctor will not give you a covenant not to treat, a covenant not to derive income from patients of the practice, and or a covenant not to hire or solicit employees of the practice. There's a lot more covenants that should be in a sales agreement in addition to the covenant not to compete. A covenant not to compete is only the tip of the iceberg. I was an expert witness once in a case where a specialist sold his practice to another specialist, and there was a covenant not to compete. But there was not a covenant not to solicit referral sources, a covenant not to accept patients from referral sources, a covenant not to derive income from the referral sources, etc. The buyer was basically out of luck and almost $1 million. Their non-dental attorney had not even known to add such kind of clauses to the contract. And number 10, a practice in which you must sign a sales agreement before doing your due diligence. I just don't understand brokers that do this. I mean, you have to sign almost a full sales agreement and give a non-refundable deposit before you can even do your due diligence. I think it's just shady and unethical. And again, a situation I would walk away. Now, you're almost always asked to sign a letter of intent by a broker or seller, but you should have a couple weeks for your due diligence and before your deposit goes hard or before you even have to submit a deposit. You need to be able to clearly see and understand what you're about to buy and just to think about it. Okay, that's my top 10 list for now. It probably isn't a complete list. And I say to all of you, use your common sense. If something doesn't seem or feel right, it probably just isn't. I don't care how much you hate your associate job, hang in there a bit longer. Don't buy the wrong practice, but find a good practice that'll provide you the income and lifestyle you want. Good luck. Thank you for listening to the Dentistry Rising podcast, Dr. Betty Robin. Please subscribe on iTunes so we can get better and better at helping you make your practice dreams come true.